Hey guys, how are you all? Let me just put on my mic. Hopefully, you guys can hear me well. Okay, so we're ready to begin. Today's topic right now is spleen. Okay, we've done pancreas 1 hour back. We just started and we just ended with that lecture on the pancreas. And I hope we are streaming live. Let me just check the stream because एक बार क्या हुआ था? I took a class and then it did not stream. So that was really disheartening. Okay, cool. So we can begin with the lecture on spleen, and this is part of my anatomy abdomen series. So those who are watching this video and haven't watched the previous videos, I have made videos, similar videos on liver, stomach, kidney, ureter, pancreas, right? So there are a few sessions which are very similar to this one, and you will really enjoy watching them just like a TV series. Okay, so just go it that way. Just think of this as episode 6 of our series. So welcome to the YouTube channel Let's Crack NEET PG, where you have the top educators, quality content, and you guys are assured a great learning experience. My name is Chetanya Mittal. I am pursuing my MBBS from AIMS, New Delhi, All India Institute of Medical Sciences. You guys can download the Unacademy learning application and attend free of cost live classes there. Okay, and all you have to do is use your mobile numbers and register here. Once you have registered, they will ask you for an invite code, and you can use my invite code that is written at the bottom of this page, that is Chetanya 10. Okay, so you can use this to unlock the free plan on Unacademy. Besides that, my referral code also unlocks a range of other offers, one of which is for the iconic subscription where you get both Unacademy as well as Prep Ladder at a discounted price. Okay, and currently you can get access to two of these subscriptions at a cost of 58,500. And if you go for the 2 year plan, it's for 50,000, and the 1 year plan, it's for 40,000. So you can go for these multitude of plans. And if you choose to go for the Unacademy Plus subscription, you can unlock a subscription that gives you 1 month free with the 3 months, or 2 months free if you get a 12-month subscription. And again, please use this authentic referral code Chetanya10, and it is my guarantee that if you are using this referral code within 1 month, you'll be credited with these offers. Okay, we have started batches for NEET PG, FMGE, NEXT, and INI-CET. Okay, we've also started batches for first prof MBBS, second prof MBBS, and very soon we are also starting a batch for third prof MBBS. After that, I've also requested the team at Unacademy to start with a batch for you guys for step 1. Okay, so that will also be coming soon. We have over 34,000 MCQs that are there on the application for you guys to solve. And so just download the app, and whenever you are purchasing a subscription, please always remember to enter this referral code. A gift box bana hoga. Just enter my referral code there, Chetanya10, and you will get a 10% discount and access to all the offers. Okay, so there are few features of the plus that I want to tell you about. We have live classroom experience in the form of batch courses. We are going to provide you with regular testing. You will be getting access to structured courses, and you will be able to ask your doubts. Okay, right, so go ahead with the iconic subscription according to me, because here you also get access to Prep Ladder at an additional cost of 15,000, and that is for 3 years. Okay, so you are getting Prep Ladder at 5,000 rupees per year. That is like a scholarship steal deal. Okay, so you guys are actually benefiting from Unacademy purchasing Prep Ladder. So if you go ahead with Prep Ladder, you get the recorded video lectures, the question bank, and the handwritten notes. And the good part is you can enjoy the live classroom experience just like attending your college classes, but in a better way on the Unacademy platform. Okay. Just give me a second, guys. Okay. So let's begin with spleen. Let's begin with spleen. Okay. So identify this organ for me, please. This beautiful, beautiful organ. So I've always found spleen to be beautiful, but somehow the spleen always looks a little sad to me. No? Haven't you always felt that there is some sadness when there is beauty? Right. So spleen, by default, the meaning, it is derived from the Latin word low spirits. Okay. So spleen, it's this organ. And before I do anything else, because I won't be discussing the borders, etc., in too much detail, I won't be discussing the external features in too much detail with you guys. So I'll just tell you a few things, and maybe you can understand the rest on your own. Okay. So this is the anterior end of the spleen. This is the anterior end. Okay. And this is the posterior end. This is going to be present posteriorly. Okay, anterior end and posterior end. And the anterior end, it is also the lateral end. It is towards the lateral side. Okay, anterior end, it is the lateral end. It is expanded. Okay, and it is a broad end. It is a broad end. Okay, it's very expanded. Okay, and it is directed downwards and forwards. Okay, so anterior end, it is directed downwards and forwards, whereas the posterior end, it is the medial, it is towards the medial side, and it is directed upwards and backwards. Okay, and it rests on the upper pole of the left kidney. ठीक है, इसके नीचे just kidney होगा. Got it? Now, the so how do you identify the anterior and posterior? The end which is broader, it is the anterior end, and the end which is narrower, it is the posterior end. That's the first thing. Okay. How do you identify superior and inferior? How do you identify the superior and the inferior border? So basically what they say is that there are three borders of the spleen. There are three borders to the spleen. Okay. Superior, inferior, and in between them there is said that there is an intermediate border. There is an intermediate border. The superior border, the characteristic feature which has been asked in your exams also is that superior border is notched. So whenever I draw the spleen, you will see that there is a notched superior border, and that is going to be, there's a notched border, and that is going to be the superior border. So the characteristic of the superior border is that it is notched, that there is a presence of notch on it. The inferior border, on the other hand, it is not notched, it is relatively smooth, it is rounded. Okay, the intermediate border, it is also rounded. Okay, that's it. Okay, now there are also two angles that I want to tell you about. One is the anterobasal angle and the other is the posterobasal angle. Okay, anterobasal angle, when the spleen enlarges, it is the one that is palpable, so it is known as the clinical angle. These are a few basic points. These are a few basic points regarding the spleen. Okay, so now you know about the 9 quadrants of the abdomen. You know about this? So the spleen, it is located like this. This is the superior border, right? Okay, spleen is located like this. So it is there in the epigastrium. The spleen, it is there in the epigastrium, and partly it is also occupying the left hypochondrium. Okay, towards its right side, there's the stomach. Okay, I'm not drawing it in proportion. Actually, I should be drawing it better. And on the left side, there is this diaphragm that is going like this. Hai. So the spleen, it is sandwiched between the stomach and the diaphragm. It is sandwiched between the stomach and the diaphragm. Okay, clear about the location? Location, borders, surfaces, I've explained. Now, one thing that you might have, your teachers might have also told you, this is called as the Harris. क्या बोलते हैं इसको? एक होता है Harrison. Harrison is a textbook of medicine. Now, there is something called as Harris dictum. Something called as the Harris dictum of spleen. Okay, something called as the Harris dictum of spleen. Harris dictum of odd numbers. क्या बोलते हैं उसको? Harris dictum of odd numbers. क्या मतलब हुआ? Anybody can tell me? Harris dictum of odd numbers. Odd numbers. It says that 1, 3, 5, 7, 9, 11. These are very important numbers for the spleen. These are very important numbers for the spleen. Why? Because 1 inch, this is the thickness of the spleen. This is the thickness of the spleen. 3 inch, it is the breadth of the spleen. And 5 inches, it is the length of spleen. 7 oz is the weight of spleen, which is equal to 150 grams. And 9 to 11, these are the ribs to which spleen is related. These are the ribs to which spleen is related. Okay. Now, an important point that you might find if you open the Gray's, you will say that मैं तो गलत बता रहा हूँ. The 41st edition of Gray's Anatomy, instead of writing 9 to 11, they say that we will not follow the Harris dictum. The spleen is actually associated to the 10th, 11th, and 12th rib. 10th, 11th, and 12th rib. So that is a new update in Gray's Anatomy. Okay, that is a new update in the Grey's Anatomy. But as far as your college exams are concerned, I don't think that they are going to be including this update. So when you write for your college exams, remember 9 to 11 is all right. Okay, but by chance somewhere they give you an option of 10 to 12, be alert to answer as that. Okay, something you can be alert about. ठीक है. अब क्या होता है इसमें, just understand how is the spleen oriented, what is the direction of spleen. I'm not saying direction of splenomegaly, I'm saying what is the direction of the normal spleen in the body. So just keep your hand on your ribs and you will understand how the spleen is oriented, right? Your ribs, they are curved like this. So they are directed downwards, forward and medially. And that is how the spleen has to be placed. Not on the right side, on the left side, obviously. There was one person in our Viva, okay, who said that, who picked up the spleen. उसने कहा, this is the spleen of the left side. ठीक है, तो एग्जामिनर ने कहा अरे वाह, राइट साइड वाली कौन सी होती है बताना. So always remember, एक ही spleen है body में, it is on the left side and it is directed downward, forward, medially in the direction of the ribs, same as the direction of the ribs. And the axis of the spleen, it is in line with the 10th rib. It is in line with the 10th rib, है ना. 9, 10, 11 है, so it is in line with the 10th rib. अगर 10, 11, 12 होगा तो it is in line with the 11th rib. So 10 और 11 दोनों हो सकते हैं. For now go with 10th, but when textbook start updating it, you can go with 11th. ठीक है, तो बाय चांस ऑप्शन में 11 दिखे, so you might prefer this. Got it? Clear? Understood? Understood? Any doubts? Okay. Now in the last video, I was telling you about the various ligaments of the spleen. I was telling you about the various ligaments of the spleen because I had mentioned the tail of the pancreas. So I told you about the linorenal ligament. Okay. So you all know linorenal ligament now. Linorenal ligament, it is between the kidney and the spleen. Okay. And the word lino, it is being used for the spleen. So therefore it has what vessels? It has splenic artery and splenic vein. So I will write it has splenic vessels. And besides that, it contains the tail of the pancreas. So this question is often asked. The tail of the pancreas is present in which of the following ligaments? Answer is going to be linorenal ligament. Second ligament is the gastrosplenic ligament. Gastrosplenic ligament. So gastrosplenic ligament, it contains, it is present around the stomach, okay, around the fundus of the stomach. So there you have the short gastric vessels and the left gastroepiploic artery. Left gastroepiploic artery. Okay, it will also have a few nerves, etc. Okay, let's say this is the stomach, and somewhere here you have the spleen, right? So this ligament is present here, and as you all know that this region, it is supplied by the short gastric arteries, and here this will be the left gastroepiploic artery coming from the splenic artery, And third ligament, it's the phrenicocholic ligament. It's also important. Okay, I'll take it to the next page. Third ligament is the phrenicocholic ligament. It is not attached to the spleen. It is not attached to the spleen, right? It is present below the spleen. So it provides support to the spleen, to the anterior end, right? So it provides support to the anterior end of the spleen. Okay. And you only have a phrenicocholic ligament on the left side. You don't have one on the right side. There is no phrenicocholic ligament on the right side. Okay. So because of that, the infections on the left side, they cannot go above. The infections on the left side, they cannot go above the paracolic gutter. But on the right side, there is no phrenicocholic ligament. So the infections, they can travel higher up. Okay, so this is a very important point, that on the left side, because of the presence of phrenicocholic ligament, infections cannot cross the paravertebral gutter. They cannot cross the paracolic gutter. Why is it called as paracolic gutter? Because see, here you have the descending colon, here you have the ascending colon. So there is some extra space on the sides. So this space here, it is limited by the phrenicocholic ligament. But here you don't have a phrenicocholic ligament, so infection, it can spread above, around the liver, है ना. वहां पे भी कुछ कुछ रिसेसेस वगैरह होते हैं, बट हियर इट कैन नॉट गो अप. क्लियर? Got it? Okay. Now, very quickly, I'll tell you about the blood supply. Nothing difficult per se. The artery name is also very simple. It's the splenic artery. Artery is splenic artery. One thing to remember about the splenic artery is that it is a branch of the celiac trunk. It follows a tortuous course. Tortuous means it is very twisted. It is twisted. It is a posterior relation of the body of the pancreas, right? Sorry, it is running along the upper border of the pancreas, and it is the largest branch of the celiac trunk. Okay, so these are a few points about the splenic artery, and it is going to pass through the lienorenal ligament to enter the spleen and divides into 5 branches. Okay, blood supply of the spleen is controversial whether it has closed circulation versus open circulation. So that is a little controversial. And when we discuss the histology of spleen, now I would like to discuss this here rather than discussing it in the gross anatomy, because there I will be able to explain the sinusoids and penicilli and everything to you. So I'm not explaining it here. Okay. So what are the branches of the splenic artery? It gives the left gastroepiploic artery, left gastroepiploic artery, left gastroepiploic artery, 5 to 7 short gastric branches. And if you remember in the blood supply of the pancreas, I told you that spleen, it also supplies the pancreas. So it gives a lot of pancreatic branches. Okay. If you remember arteria, chordae, pancreatis, arteria, chordae, pancreatis, and arteria pancreatica magna. Now, so there are a lot of pancreatic branches that come from the spleen. Okay, so splenic artery, that is about it, about the splenic artery. Then surgery people, they'll also tell you about an avascular pain, blah blah blah, बहुत चीजें होती हैं, ठीक है? इतना बहुत है. Then venous drainage is very simple. Splenic vein, it is joined by the, okay, this is a splenic vein coming from the spleen. It is joined by the inferior mesenteric vein, and ultimately it merges with the superior mesenteric vein to form the portal vein. ये venous drainage होगी. One important point is that the spleen, it does not have any lymphatics. It does not have any lymphatics. It does not have any lymphatics. Very, very important. CNS does not have lymphatics. Bone marrow does not have lymphatics. Spleen does not have lymphatics. That's very, very important. That's high yield to know. Very, very high yield to know that spleen does not have lymphatics. Okay. Nerve supply, again, not important. उसके अलावा histology and development है. Histology and development. So let's skip that and let's move to the clinical points. Okay, one thing I forgot to tell you is the impressions on the spleen. है ना? I had to tell you the impressions on the spleen, right? Yeah, just give me 1 minute. Right. So this is the spleen, and please remember in the new grades, instead of 9th, 10th, and 11th, it is 10th, 11th, and 12th. Okay. So now you can make out. Now you can make out that this is the intermediate border. This is the superior border, which is having notches. Superior border, it is notched, right? And inferior border, it is rounded. So this is the intermediate border. This is the superior border, which is having notches, and this is the inferior border. So these are the borders, है ना? And please remember that the superior border is notched. Okay, this has been asked in the exams also. Above the, so here you have the hilum in the center. Above the hilum, this region, this large impression is called as the gastric impression, right? Obviously, the stomach is related. Below here, you have the left kidney, so you have the renal impression. And there's a small part of the pancreas, that is the tail of the pancreas near the hilum. So this is the pancreatic impression. And below is the splenic flexure. If you remember of the colon, you had a splenic flexure. So this is called as the colic impression. So very simple to remember. There's sort of a triangle and uske bahar ek aise wala triangle. So how I used to remember was I used to draw the triangle for pancreatic impression. एक लाइन ऐसे बनाई, एक लाइन ऐसे बनाई, एक लाइन ऐसे बनाई. ये हो गया कोलिक इंप्रेशन, इधर हो गया रीनल इंप्रेशन, इधर हो गया गैस्ट्रिक इंप्रेशन. So impressions are very simple and you can easily draw this diagram. Okay. Now, do you want me to show you diagrams of the arterial and the venous drainage, or you will be able to do that? Okay, देख लो. This is the arterial drainage. Very simple. It's the splenic artery. Okay, and splenic artery, as I told you, the pancreas, it will somewhat be located like this. So the splenic artery, it runs along the superior border of the pancreas. And splenic artery, it gives short gastric arteries here to the stomach and left gastroepiploic artery. Okay, so arterial drainage is very simple. Arterial drainage, it's very simple. And let's quickly revise the venous drainage also. I'll show you an image for that. This is the venous drainage. This is the venous drainage. So if you have a look at the venous drainage, this is the portal vein, right? Splenic vein coming from the spleen. Short gastric veins drain into it. Left gastroepiploic vein drains into it. Inferior mesenteric vein comes and merges into the splenic vein only. Okay, it does not go directly to the portal vein. So who forms the portal vein? Splenic vein by merging with the superior mesenteric vein. Okay, all clear here? No doubts regarding spleen. No doubts regarding spleen. Okay. So next thing that you guys need to know is the clinical anatomy. Next thing that you guys need to know is the clinical anatomy. Clinical anatomy of the spleen. Ready? Ready to learn clinical anatomy of the spleen? Have you guys understood everything? Please remember to hit the like button if you guys have understood everything. एक बार, just for my sake, please hit the like button. Okay, so let's begin with the clinical anatomy points. So clinical anatomy points, they are not too much to discuss at this stage. So about the spleen, you should understand is that there is a possibility of accessory spleens. ठीक है, जब spleen बनती है ना, initially there are a lot of छोटी छोटी spleen होती है. इनको क्या कहते हैं? Spleeniculi. These are called as spleeniculi, and they will all merge to form a single spleen. But if they don't merge, you can have accessory spleens. You can have accessory spleens. First thing is regarding accessory spleens. First thing is regarding accessory spleens. First thing is regarding accessory spleens. Second thing is regarding palpation of the spleen. Second thing is regarding palpation of the spleen. Palpation of the spleen. Okay. So normally the normal spleen, it is not palpable. The normal spleen, it is not palpable. It is not even palpable. So let's say I have a spleen, and spleen, remember, it enlarges towards the right iliac fossa. That is the direction of splenomegaly. So let's say this is the 1x size of the spleen. When it becomes 1.5 times larger, will it become palpable? No. It only becomes palpable when the spleen has enlarged approximately 2 to 3 times in size. It is only palpable when it is enlarged 2 to 3 times in size. What does that mean? That if you can feel the spleen is enlarged more than 2 to 3 times. Okay, it is really big. The spleen has become really big, and that is problematic. Okay, it can occur in a lot of places. It can occur in malaria. It can occur in liver cirrhosis. It can occur in blood cancer. It can occur in Kala Azar, right? So these are 4 causes where you can have enlargement of spleen. Okay, very obvious: malaria, liver cirrhosis, leukemia, Kala Azar. And when you come to your medicine now, they will ask you what are the various causes of splenomegaly. What are the various causes of splenomegaly? Then splenectomy, it is the removal of spleen. Splenectomy, it is the removal of spleen. Splenectomy, it is the removal of spleen. And splenectomy, it is also a treatment for certain conditions. You can tell me which are those conditions. And spleen is also the most ruptured organ in the abdomen. अगर कोई बहुत जोर से यहाँ पे मारे ना तो spleen can rupture very easily. And because of that there can be pain. Because of that there can be pain, especially towards the left side. Okay. So this is called as Kehr's sign. Rupture of spleen, it is associated with Kehr's sign. It is associated with rupture of spleen. Anybody can tell me what is Kehr's sign? Anybody who knows what Kehr's sign is? क्या होता है exactly? Kehr's sign में क्या करते हैं? It's the basically कुछ करना नहीं होता. When the spleen ruptures, you have pain in the left shoulder. That is because spleen is just near the diaphragm. The diaphragm से phrenic nerve आती है and phrenic nerve it goes to the left shoulder. So when the spleen ruptures, the left shoulder pain it is very common. Okay, left shoulder pain it is very common and that is called as Kehr sign. ठीक है, याद रखना important चीज है ये let me make a person for you. ये आपका डायफ्राम है लेट्स से, है ना. तो इधर एक ऑर्गन था ऑन द राइट साइड, दैट वाज योर गॉल ब्लैडर, एंड ऑन द लेफ्ट साइड यू हैव एन ऑर्गन दैट इज स्प्लीन. So when you have a gallbladder irritation, that is going to go from the right phrenic nerve to the right shoulder. So if you have right shoulder involvement, that can indicate gallbladder pathology. And if there is left shoulder, okay, that can be due to a rupture of spleen, and that is called as Kehr sign through the left phrenic vein. Sorry, left phrenic nerve. ठीक है, और भी कॉजेज हो सकते हैं शोल्डर पेन के. ठीक है, इवन हार्ट अटैक कैन कॉज शोल्डर पेन. देयर आर अदर कॉजेज ऑफ शोल्डर पेन, बट दीज आर आल्सो टू पॉसिबल कॉजेज. राइट शोल्डर पेन, गॉल ब्लैडर, लेफ्ट शोल्डर पेन, स्प्लीन, स्प्लेनिक रप्चर. हाँ, गॉल ब्लैडर से रिलेटेड कौन सा साइन था? मर्फी साइन. इससे रिलेटेड कौन सा साइन है? केयर साइन. मर्फी साइन इज स्लाइटली डिफरेंट. इट इज नॉट रिलेटेड टू राइट शोल्डर पेन. इट इज रिलेटेड टू अ लॉन्ग, मतलब आह की आवाज ऑन इंस्पिरेशन व्हेन यू टच द गॉल ब्लैडर. इट इज दैट सॉर्ट ऑफ अ साइन. बट कोई बात नहीं. I'm glad you guys remember Murphy's sign from the lecture. And I will also be taking a class on the clinical anatomy of the gallbladder. एक class लूंगा मैं on the clinical anatomy of the gallbladder. ठीक है, चलो ठीक है. Okay guys, I think we'll be ending the class now. Thank you so much for watching, and this is my referral code in case you guys wish to take a subscription. Please remember to hit the like button for this video, share it with your friends, and subscribe to our YouTube channel as well as our Telegram channel, which is by the same name. You can find it in the description. And I'll also be sending all these notes on the channel at the rate Unacademy NEET PG Chetanya. Do remember to drop a comment once this video stops streaming and hit the bell icon for notifications. The last thing that I got to tell you guys is that in another 15 minutes, we are going to be starting with an MCQ session, and that MCQ session at 5 o'clock, it is on the topic of stomach, which we have already done on 3rd June as a YouTube lecture. So if you haven't watched the lecture on stomach, quickly watch it on 2x and join me at 5 o'clock for the MCQ session on stomach. Okay, bye bye guys. Thank you so much. Take care. Thank you Krati for being such a patient listener, and thank you so much. Yeah.